This is what 100 eggs looks like, and I'm eating them all in 10 days. Then we're going to check my cholesterol, the fractionation, and a bunch of other bioindicators. Let's get started. I'm excited to share with you what happened after I ate over 100 eggs. I'm going to come out of my shell and tell you exactly what happened to my lab results both before and after eating, again, over 100 eggs. And yes, we can't help it. There's going to be a lot of egg jokes. Just please be patient with us. It's just like Cool Hand Luke said.
I can eat 50 eggs.
Nobody can eat 50 eggs.
Nobody ever eat 50 eggs.
Except I ate 100, actually more than 100 eggs. I took a little bit longer. I took 10 days. So these are eggs number 1, 2, and 3 out of the total of 100, and the first one's for today. I just put them in microwave with a little bit of butter and some bacon. It's one of my favorite ways of eating eggs right now. So this is right after I ate those 4 eggs for dinner. We came out and I ordered a salad. So no, we're good. So as you can see, I got yet another egg. So now this will be egg number 12 for today. I'm overachieving with eggs. So it's day 2 of the Big Egg Challenge. I'm starting out over goal. Had 12 eggs yesterday, and these are eggs 13, 14, and 15. And I'm not sick of eggs yet. So here's my baseline in terms of labs. Let's get right to that. I started with a fasting glucose of 86, fasting insulin of 2.2, and an A1C of 5.3%. So I've shared it in the past. I am a 67-year-old man. So like most 67-year-olds, I have significant metabolic disease, prediabetes. In fact, many of my tests have indicated full diabetes, type 2. But I've taken that risk off the table with lifestyle. So that was where my labs were in the beginning, at least in terms of metabolic disease. Now, where did it go? My glucose went from 85 to 88. That's not a significant change. My insulin went from 2.2 to 2.1. Also, not a significant change. A1C went from 5.3 to 5.2%. Again, my metabolic markers stayed rock solid. Now, I'm not going to yoke around with you too much about what happened next because I just kept eating eggs. Okay, we're ready now. So day 2 of the Big Egg stunt, fiasco, experiment, whatever you want to call it, where I said I was going to eat 100 eggs in 10 days. So far, I'm above goal. It's lunchtime, and I've already eaten 15 eggs. 3 for breakfast day 1, 3 for lunch day 1, 5 for dinner yesterday day 1, 3 for breakfast, now 4 more. So, and as you can see, I'm not the greatest cook. I don't have a lot of variety. I'm microwaving these eggs with some butter and bacon, and then I'm going to go work out. And so far, I'm still loving these eggs. So these are eggs 20 through 23, and frankly, I'm having more trouble keeping track of them than I am eating them. They're still good. Day 3, breakfast, 4 eggs, eggs number 24, 25, 26, and 27. Lunch, day 3, 28 through 31. Okay, so I checked. It's day 3, dinner. These are eggs 32 through 35. And I'm about to get tired of eggs. So day 4, breakfast, numbers 36 through 39. It's okay. Okay, so this is day 4, dinner, eggs, what was it, 45 through 48. And these are special eggs from chickens grown by my niece Heather. You want to tell them about your chicken exploits?
Well, they're just a lot of fun. If you don't have them in can, you should get some. So we'll leave it at
There
that.
you go. So I woke up this morning feeling a little bit nauseated and immediately thought of eggs. Didn't want to eat any more eggs. I went in, recorded a couple of copies of the apple cider vinegar video, and did a little workout. Started getting hungry. So once I started getting hungry, guess what I decided to have? This is day 5, and that's eggs number, I think it's 48, 49, 50, 51. Before I crack you up, let's talk about eggs, not legs. Let's talk about eggs and labs. Total cholesterol. This was prior to the test, prior to the eggs demonstration. The total cholesterol was 162, triglycerides were 33, HDL was 67, LDL was 86, and ApoB was 79. The LDL and ApoB requires some discussion, but we'll get to that a little bit later. These labs were done the week before I did the egg demonstration. Now, I did labs the week after, over 100 eggs. Here's what happened. Total cholesterol went up to 220, triglycerides to 41, HDL to 73, and wait for it, LDL to 135, ApoB to 110. Well, could we say it looks like eggs raised my cholesterol? And now we're done, and let's just exit the video. Well, not so fast. Let's crack open the evidence just a little bit. So first of all, let's look at the studies that are out there. A recent meta-analysis in 2023 included 75 studies, and the conclusion was there are mixed results. I know, I hate to hear it. We all would like clear results, but these were mixed. Now, what about the studies? Were they good studies? Well, they were mostly observational. And I'm sure there's some expert scientists out there who would say, wait a minute, observational is just not that good. Observational is bad science. You want to have randomized clinical trials that are double-blinded. Think about it. Food science is just rampant with bad studies, or at least inconclusive studies, because how can you take a group of hundreds of people, randomize them to certain foods day after day after day, and then even blind them to the foods that they're eating? I mean, how can you do that? And that's the core of the problem with food science. So, is there a clear answer here? Let's dig a little bit deeper. Some studies reflect that what happened to me, that LDL increase, it's not really reflective of higher cardiovascular risk. Well, let's look at this meta-analysis. A year earlier, another meta-analysis found that there was a couple of things that they found. Number one, based on a cohort study out of this meta-analysis that lasted 31 years, for every 300 milligrams of additional cholesterol, there was an 8 to 10% increase in heart disease risk. Now, that was a cohort study. It lasted 31 years. That sounds kind of powerful, right? Well, not so fast. One large egg has 186 milligrams of cholesterol, and you may want to think, oh gosh, this is dangerous. But the complete meta-analysis, including 41 studies, showed the risk was minimal, maybe only 4%. The conclusions, again, continue to get muddy. There are different results for different populations. For example, Asian populations tend to get still conflicting results. At the end of the day, you get conflict after conflict in terms of drawing conclusions. And I have to tell you, it was good for me to go back and review these literature. I fully expected my LDL and cholesterol to remain solid. I also knew, quote, knew that my metabolic disease would not change. my metabolic markers would not change. Well, I was right about the metabolic markers, but not so right about the LDL. And again, the question then becomes, did that increase in LDL reflect an increase in cardiovascular risk? Let's go back and talk about another item. Do eggs increase cholesterol levels? Let's just get that straight. A lot of people would say they do up to a certain threshold. The body just won't absorb all the cholesterol, so that's one mechanism of change. Other mechanisms of change happen too, change in terms of your metabolism. For example, your liver decreases cholesterol production when you're eating more cholesterol. Hey, a quick comment. After recording, we realized that there's some really good information that you might be interested in regarding why eggs might not really raise your cholesterol level in your blood. We give you a link in the description to a video by our friend, Nick Norwitz. He's the Harvard medical student that ate 720 eggs. So that's a couple of things to think about. Another thing to think about is, well, what's the impact of eggs and what's the impact of something else? Like in my case, did my LDL actually go up because I was eating more cholesterol, or did it go up because, again, those eggs replaced some of those carbs that I had put back into my diet after my experiment with carnivore? What am I talking about here? Let me go back and give you some details. My LDL remained 55. We can go back and show you multiple episodes where my LDL remained very, very low for about 30 years, the vast majority of my life, until this past March, April, May time period. What happened then? Well, I went from my usual 40 to 90 carbs per day, low carb, but not full keto, down to 20 to 40 carbs per day. And guess what happened when I dropped from 40 to 90 carbs per day to 20 to 40 in March, April, May? Well, my LDL shot up from 55 to 135 to 182, even though my metabolic markers continued to improve. So what is that called, and have we seen that before? We've seen that many times. It's a major debate in the preventive cardiology community right now, in the preventive medicine longevity community. It's called lean mass hyperresponders. You've seen us bring on Dave Feldman, Nick Norwitz, Adrian Sotomoto, researchers in this area. They're getting pummeled because the lipidologists, the doctors that are practicing the standards of medicine out there, still want to just do the simple, easy thing. And what's the simple, easy thing? Just check the LDL and treat that. If somebody's LDL is high, give them a statin. Well, this information is beginning to throw that into question. As more and more people go onto low-carb diets, we're seeing this more and more. We used to know that it was the case that people that go on very low-carb diets can often increase their LDL. But that was not that popular until the past few years. With the popularity of carnivore and the ease of getting into ketotic state with carnivore diet, we're seeing more and more people go into what's been labeled as lean mass hyperresponder. What that means is your metabolic health is excellent, unlike most people with cardiovascular disease. On the other hand, your LDL is not low like most people that are in great shape. Your LDL begins to skyrocket, going up to 200 or more. So is that what happened to me? It certainly looks like it. Was that raising my LDL? It certainly looks like it. Well, what did it with me with this egg experiment? Well, and that's where I want to talk about egg experiment. You can call what I did science. It's what many of us talk about as an N of one. In other words, there was only one subject in this study, and there were more variables with me, like low carb and manipulation of my carb amount, whether I meant to or not. There were some other things going on, and we'll talk about that when we get to the inflammatory process, my inflammation numbers. So again, to get back to the original comment, it's very hard sometimes to isolate what was caused by eggs and what was caused by something else. So the question is, does high cholesterol mean cardiovascular risk? I don't think so. I don't think it's about LDL. I think it's much more about triglycerides and metabolic disease. You may have heard me mention ApoB. The lipidology community is now saying, let's don't focus so much on LDL. Let's focus on ApoB. Here's the reason. One of the major reasons is ApoB gives us more information about metabolic disease. Let me stop. If you've heard that term a couple of times, metabolic disease. What is that? It's prediabetes and diabetes. Well, what starts out as a problem burning carbs very quickly becomes a problem burning both carbs and fats. So this is day 5, and I think eggs 52 through 55. I've got them written down. We'll go over them in the video. I've only got 2 left in here. I've already eaten 2 because I'm juggling appointments and recording sessions. And the eggs are not so bad again today. This is day 5 dinner and another excellent meal. And you're already going to have heard a lot of those puns. Feeling okay. Getting tired of eggs, but feeling okay.
Day 6, breakfast, 60, 61, 62, and 63. And I'm still loving them.
So here we go, day 6, lunch, 64, eggs number 64 through 66. As you can tell, I'm mixing it up a little bit. No, not 64 through 66. 64, 65, 66, 67. And I'm mixing it up a little bit. I'm getting a little bit of egg salad now and a couple of boiled eggs. Having a blast. So, dinner day 6, Wednesday, August 28th, I think. Eggs number 68, 69, 70, and 71. And still loving it.
Yeah. Day 7, eggs number 71, 72, 73. No, wait a minute. 72, 73, 74, 75. And I can't count very well, but I'm still loving my eggs, believe it or not.
So this is day 7, lunch. I just got finished with a YouTube live on natto. And I was thinking on the way down, I really am tired of eggs. I'm not sick of them, but I'm tired of them. But I got down here and I got started preparing it. A couple of boiled eggs and a bunch of egg salad. I took a taste and it tastes pretty good. So here we go with some more eggs. 76 through 79. Dinner, day 7, eggs number 80. 81, 82, and 83 with a great salad. Now let's look at my lipid fractionation. It's where you look at the breakdown of your HDL, the breakdown of your LDL. You see, those come in varying sizes and density levels. I'm not going to go deep into that other than to say, here's what happened. I don't care too much about the first 3 numbers. I don't focus on those. Why? Because they are driven by your LDL value. So if your LDL total is high, your LDL particles, your LDL small, your LDL medium are all going to be high. Now, the most important out of all of these numbers is your HDL large. The most important part out of the fractionation is HDL large. And as you can see, my HDL large went from 4583 to 6338. In other words, really good numbers there. Well, an improvement in my numbers. I would love to have HDL large up around 10,000. I'm just not there. But what did the eggs do? Or was it decrease in carbs? Replacement of carbs with eggs. Something helped my HDL large. Now, let's talk about HDL for a second. Multiple papers have associated HDL particle size with insulin resistance. The smaller the particle, the more insulin resistance. And as you could see, I got significant improvement in my HDL large. I do use HDL large to track progress of insulin resistance. You do see some variation in the number. I wouldn't get too concerned if I had dropped a little bit, but I am positive about getting some increase. Here's my LDL pattern. It remained the same, an A pattern. Similar to HDL, evidence shows large, fluffy LDL particles are just less inflammatory. Is it that the particles are less inflammatory, or is it a biomarker? I'm not going to go down that bunny hole. I personally think it's a biomarker rather than the actor in that play. But either way, all of us who study this agree it's better to have a significant healthy number of HDL large particles and LDL large particles. It's also better to have an A pattern on LDL, which means you've got sufficient LDL large. I do acknowledge some of this gets confusing. Some of the evidence is conflicting. And here's what's going to happen most of the time with most cardiologists, most internists, and most family practitioners. They're not going to futz around with all that. They're just going to go back and say, hey, your LDL's high or your ApoB's high. Let's give you a statin. Is that the right way to go? I don't think so. I think we need to sweat the details. I think we need to give the patient the information. And I think the patient needs to be able to make his or her own informed decision. Now, I don't use fractionation for diagnosis. I use it to provide better understanding of metabolic disease, not cholesterol. HDL and LDL are, in my mind, not really actors in this play so much as indicators, signposts of what's actually happening with metabolic disease. They're clearly worth measuring. A recent meta-analysis of 30 studies showed a link between particle size and cardiovascular risk. Larger particles, more protection. Again, as with everything else in this space, research is still ongoing.
Okay, so this is day 8, breakfast, egg number 88, 84, 85, 86, and 87. And I'm still loving those eggs. Haven't combed my hair yet. And if you've noticed this, I had basal cell removed. I got a lot of, I've had 50 of them. Okay, eggs, day 8, number 88, 89, 90, and 91. That's a good looking salad, isn't it? So, day number 8, dinner. We're just clearing land, and we're out at a restaurant. I forgot to bring eggs, but we came to a nice restaurant, and we're having, we got 2 eggs there. So, eggs number 92 and 93. Still loving those eggs. Saturday, August 31st, day 9, breakfast, eggs 94 through 97. I'm doing a little sous vide action there. Guess what? Day 9, lunch, eggs 98, 99, and 100. And I'm still loving these eggs. I might do this again sometime. Depends on how the reaction is. Well, we couldn't get my blood drawn today for the follow-up labs, LDL and such, so I'm still eating eggs till we do. So guess what? I'm back at it. That's this is day 9, and that's eggs number 101, 102, and 103. Day 11, breakfast. Eggs 115 through 117. still going strong.
So here we are in Dallas at the Bid Summit. I'm here with Jesus Tarantino, and yep, he's still making me eat eggs. 3 more today, 118, 119, and 120. I just got my blood drawn. We'll see how that looks. I've mentioned a couple of times my inflammation panel. There's some interesting stuff there too. I started with a microalbumin creatinine ratio of 6. That's a bit high. Well, it's borderline. A CRP of 1, also borderline, at the edge. MPO and LPPLA2 were both normal. MPO at 244, LPPLA2 at 109. Don't confuse LPPLA2 with LP(a). People do that a lot. MPO and LPPLA2 are actually, again, actors in this play. They're enzymes released by our immune system to attack plaque, or something else, which we'll get into in just a minute. After over 100 eggs, my microalbumin creatinine ratio, the indicator of the health of the lining of my artery wall, that actually decreased, which is a good thing. CRP increased to 1.4. That's interesting. Why would it do that? MPO remained within range, and LPPLA2 increased. So am I developing some inflammation here? It certainly looks like it could be early smoke or an early mixed picture for cardiovascular inflammation. I usually don't evaluate these things separately, but you have to understand and think through each of the items that we're looking at. There's an old adage in medicine, and that is, if you have a panel of tests, it means there's no single good, reliable test. So let's get into a little bit more detail on these tests and see if we can understand them as well. CRP, a geeky phrase concept here, but hang on, it'll get clear in just a second. C-reactive protein, out of the bunch, is the one that has the most common biological false positives. Before you start getting twisted around about that, let me just tell you, a lot of things cause positive CRP. Cuts, bruises. The one time I had a very high CRP was 2 weeks after I had a viral infection, a viral sore throat. Now, I mentioned cuts, and you may remember there were a couple of weeks that I appeared with a large bandage on my neck. I had a basal cell removed, basal cell cancer, during this time period. And again, this starts to get back to, you get more, in these experiments, these demonstrations, these stunts of N of 1, you get more variables than you do people in the study participants. So was my slight elevation of CRP, was that associated with my surgery? Or was that associated with increased cardiovascular inflammation? We'll never know for sure, but we'll get more indicators as I continue to go through testing. I suspect it was the basal cell. The microalbumin creatinine ratio, the MPO, both. No significant change. Both remained normal. Now, my LPPLA2, why did that increase? With most of our lean mass hyperresponders, people that are in great metabolic health, but their LDL shoots up, we start to see increases in this one indicator. Now, at first I thought that must just be me. I must just be seeing it. But then we looked it up, and sure enough, I'm not the only one that sees that. LPPLA2 is associated with increases specifically in LDL. Now, what does this all mean, especially with the LPPLA2? Well, it does mean that LDL can increase inflammation. It does mean that there may be something there with increased LDL and LDL oxidation. But there's also a caveat. I don't think this marker alone is indicating increased cardiovascular risk. I've seen thousands of patients, and it looks like each person has a threshold. Mine is appears to be about 120. for LDL to start raising my LP-PLA2. As you can see, there's so much debate about so many of these details. You have to ask the question, well, how can my doctor make all my decisions for me? I'd like to know the details, and then I'd like to make my own choices. That's the way we do in our practice, and that's the way I do as a physician. I don't want to make your choices for you. I can't, because lifestyle is so important. And whether or not you even take a medication, that's your choice, not mine. So when you put it in movie context, you're Luke Skywalker. I'm just Yoda. I've been in a lot of these battles before. I have a lot of capacity to help, and I can help you. But you need to know the information. I need to give you that information so you can make the right choice for you. So some patients, when they run into this issue, especially our lean mass hyperresponders, who start showing that increase in LP-PLA2, some of them say, I'd like to try something in terms of a medication. Some of them say, I'm not worried about that. I'm just going full steam ahead. Some of them say, you know what? I'm going to add a few carbs back. And again, you need to make the choice that's right for you. I just need to help you get there. In my case, I'm not concerned. My experiment was full of uncontrolled variants, as we discussed, ranging from these carb variations, most of which I was trying to control, but some of which I didn't really that well. And I wasn't going to delay getting my basal cell surgery. I'm one of these people, by the way, that by my age, at age 67, I've had over 50 basal cells. I'm high risk for that. After all, eggs have plenty of nutrients, and the bottom line is everyone is different, not only in terms of our metabolism and our genetics, but our choices and our goals. So, what do you do after what you've heard here? Do you eat eggs or not? That's your choice. I'd love to hear your comments at the bottom. I suggest that you find out exactly what works for you and what doesn't. So there you have it. After eating 100 eggs in 10 days, actually over 100, my cholesterol did increase. Did the eggs do it? Or did the replacement of carbs by eggs do it? I don't think we're ever going to know for sure. But does that mean I'm going to have a heart attack? I don't think so. Does it mean I'm going to stop eating eggs? I'm not going to eat 10 and 12 a day, but I'm usually eating about 2 per day now. So no, I'm not going to stop eating eggs. I might slow down. I'm not going to eat that many, but I love eggs, poached, fried, boiled, or especially deviled eggs. I'll continue to eat them. They're still part of a healthy diet in my book. Just make sure you understand your own cardiovascular risk. Lifestyle is king. Diet and exercise are critical. One of the things that I'm finding, one of the key trends that we see is that people that become informed and lose a lot of the weight, the body fat that they needed to lose, many of them are doing very well, except they're not getting the muscle work in that they need to get. Especially at age 65 and beyond, you begin to lose muscle. And remember, metabolically active, strong muscle, not so much big muscle, but strong muscle is your best internal safety valve against what's killing and disabling the vast majority of us, and that is metabolic disease, not LDL. Now, some people make choices to use medications, and some look at over-the-counters, some look at supplements. Those all have their place. In fact, one of the other things that surprised me recently was how much confusion there is about aspirin. We just did a video on aspirin to explain what's actually happening in that area. If you have interest, take a look here.